Mr. Speaker, I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include any extraneous material on the subject of this special order hour.
Without objection, so ordered.
Thank you. It is with great honor that I rise today to anchor this CBC Special Order Hour. For the next 12 minutes and 30 seconds, members of the CBC have an opportunity to discuss the importance of Suicide Prevention Month, an issue of great importance to the Congressional Black Caucus, Congress, the constituents we represent, and all Americans. At this moment, I'd like to yield to the gentleman from Louisiana, Troy Carter.
Thank you, Mr. Speaker, and thank you, Madam Chair, for the opportunity to speak. As we come together for Suicide Prevention Month, I'm deeply aware of this heartbreaking crisis is hitting the Black community hard. The CDC reported that in 2023, the suicide rate among Black Americans rose by 19%, with Black youth experiencing the hardest and sharpest increase of any racial group in the nation. This alarming trend highlights the urgent need for action. Every life lost to suicide is a tragedy that makes waves through communities and through families, leaving a void that cannot be filled. Yet too many of our loved ones don't get the mental health care and support they deserve. As lawmakers, we must confront the uncomfortable truth that our current system is simply falling short. The Congressional Black Caucus has been at the forefront of addressing this epidemic, working tirelessly to secure critical mental health resources. But our work is far from over. Suicide Prevention Month offers us a moment to reflect on what more we can do, how we can ensure these resources reach every individual in need, and especially our youth. We must expand access to culturally competent mental health care, reduce stigma, and create special spaces, safe spaces, for our open conversations about mental health. That's why I introduced the Mental Health Workforce Act to address racial disparities in the mental health field. The bill seeks to allocate resources and establish programs that focus on the unique needs of marginalized communities, ensuring equitable access to mental health services. Numerous barriers to access mental health care treatment persist in communities of color, including the stigma associated with mental illness, general distrust of healthcare institutions, and the lack of health insurance. Together, we can change the trajectory of this crisis and ensure a future where every life is valued and protected. It's critically important that you know you are not alone, and we are here to help. Thank you, and I yield back.
Thank you, Representative Carter. I now yield to my co-anchor, Jonathan Jackson from Illinois.
Thank you, the Honorable Sheila Sherfilis McCormick. Mr. Speaker, I rise tonight because we gather on this floor to give recognition to a growing and troubling problem in America today. Never before has so many young people, and in particular so many African-American young people, been susceptible to the tragic influence of suicidal thoughts. And one of the things that we cannot leave out of this discussion is how much the anxiety of our politics has contributed to the overall dysfunction that has become a cancer on the lives and mental health of America's citizens. I say to you tonight, when people have to worry about political violence and insurrections, that's a strain on mental health. When people have to be concerned about losing their health care and when they need it most. When people are concerned about the attacks on Medicaid and Medicare, or not being able to make decisions on their own bodies, or whether or not there will be a shooting in their school today. And when people have to listen to the former president of the United States demonize Haitian immigrants with absolutely no evidence for the erroneous claims he happens to be making. It is no wonder that America has become a nation riddled with anxiety. And let us be very clear, we will have to live and we will be connected to the conditions of one's life. I am not a mental health expert, Mr. Speaker, but I happen to believe that people who have something to live for are often engaged in the acts of living with a sense of promise and hope. And I understand that mental health diseases are real and must be treated separately. But there are a lot of people in this country who contemplate ending their lives not because they have a mental health disease, but rather because the conditions in which they have to live have become overwhelming and completely debilitating. Mr. Speaker, I would like to yield the remainder of my time and to enter my further remarks into the records of the Congressional. I yield back to my honorable co-anchor, the Honorable Sheila Sherfields McCormick.
Thank you so much. Mr. Speaker, I yield the rest of this time to myself. Can I inquire how much time we have left?
7 minutes.
Thank you. I rise today during Suicide Prevention Month to bring attention to a deeply troubling issue affecting our nation, racial disparities in suicide rates, particularly among Black youth. According to the recent data from the CDC, the suicide rate among Black youth aged 10 through 19 climbed by a staggering 54% between 2018 and 2022, exceeding the first time of their white peers. In my home state of Florida, where the suicide rate among Black teens is the third highest in the country. The need to address this crisis is especially urgent. Black youth are also significantly less likely to receive the mental health support they need as they face stigma and mistrust towards the healthcare system. Racial discrimination, economic disenfranchisement, and the lack of culturally competent mental health services fuels disparities and creates barriers to accessing care, even when it's available. We have long understood suicide prevention and mental health initiatives to be a public health interventions that benefit all Americans. It pains me to see such drastic disparities within these communities. As Black youth suicide rates continue to climb, investments in cultural competence training, mental health screenings, research, and resources are desperately needed. By taking these steps, we can ensure those at risk are connected to the appropriate, accessible, and culturally sensitive care they need and deserve. Lastly, we need to do more research into the specific risk factors affecting Black youth. Understanding the full scope of the problem is essential to developing practical solutions. Federal funding for studies that explore how stigma, cultural identity, and community engagement influences suicide risk in the Black community is long overdue. These studies will guide us in crafting policies and interventions that are both targeted and effective. The importance of prevention and awareness cannot be understated. This Suicide Prevention Month, we must reaffirm our commitment to addressing the disparities in mental health head-on and ensuring that no youth life is lost to a preventable cause. Mr. Speaker, I'd like to yield to... You done?